Good Thursday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to our hospital partners who are working incredibly hard to take care of those in our community who are sick. We know how difficult this pandemic has been on our healthcare workers, both personally and professionally, and we want to extend our gratitude to those healthcare heroes who focus on the well-being of our community. So thank you for all you're doing. Before we move into the benchmarks, we want to discuss alternative options to CDC's quarantine guidance that just came out this week. This affects people who've been in close contact with confirmed cases of COVID-19 but are not cases themselves. The cases themselves and isolation guidelines remain the same. The Tennessee Department of Health is supportive of these alternative options being utilized in Tennessee, and we will follow TDH's lead when it comes to adopting them in Knox County. However, it is important to remember that a switch like this is not immediate. The final version of these changes just came out yesterday. There are still many details to work out, and our team is in the process of working with the state to glean more information about putting these strategies into practice. The pace of this pandemic is extremely quick, and it can take time to implement new procedures. So we ask for patience and grace as we work through all of the details and train our team on the new procedures and update all of our guidance documents and resources. To put it in perspective, there are dozens of documents that will have to be pulled and updated, and several hundred people that just we here are going to have to train on the new guidance. It's also important to remember that this is a novel virus, and we expect guidance and recommendations to change as more information is learned and gathered. We've been saying that from the beginning. These changes come as a result of the scientific community learning more about the virus, which is good, and it's something that we should be expecting, and we have been expecting. For example, the CDC still maintains that 14 days is the safest option for quarantine. That is still the incubation period, 2 to 14 days. However, the chance of transmission decreases enough from data that they've been able to gather after 7 or 10 days that the benefits of shortening quarantine by increasing compliance outweigh the additional risk of the spread of the disease. The thinking behind that change is that more individuals will be able to better follow the guidelines and compliance will increase. And if compliance increases during the most likely period of transmission, then the risk of spread is considered to be lower. And now we'll move on to the local situation. We have 207 new confirmed cases since yesterday's report, giving us 19,522 confirmed cases of COVID-19 in Knox County since March. Additionally, we have 111 probable cases, 1,111 probable cases. We have 17,970 of our cases are considered inactive, giving us 2,482 active cases. 612 individuals have been hospitalized at some point in their illness, and 135 are currently hospitalized. And sadly, we have 2 additional deaths to report today, raising our total to 181. And now we'll turn it towards the benchmarks. As a reminder, all of this data that we're going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. On the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. Over this time period, we hit a new record high case volume. There were 5 red flags detected, 3 of which occurred on consecutive days, and 2 yellow flags. We saw an average of 243 new cases per day over the past 7 days, and 208 new cases per day over the past 14 days. Note the difference between that, 243 for the past week and 208 for the week previous to that. That shows how fast our case counts are growing. Because of these factors, we are representing this benchmark as red. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we utilized 2 bar graphs, one that shows a sample of tests conducted for Knox County residents and another for average time between specimen collection and lab report data. Regarding testing, there were 4 red flags and 2 yellow flags. There were consecutive days of flags during this time period. However, the total number of tests conducted has tended to increase over recent weeks, which we attribute to folks getting tested before the Thanksgiving holiday. Lab turnaround time saw 7 red flags and 2 yellow flags, all on consecutive days. Lab turnaround time in the community has increased since the beginning of September and is on average between 5 and 6 days. However, during this time period, it has been slightly higher at close to 7 days. And because of those factors, specifically the test turnaround time, we are representing this benchmark as red. Our third benchmark, sustained or increased public health capability. The goal remains to initiate investigations for all new cases within 24 hours of notification, initiate close contact investigations within 48 hours of initiation. Due to the recent process changes that we've been talking about and the volume of cases, the way we represent this benchmark previously is still undergoing changes. A traffic light color will be assigned based on KCHD's internal assessment of our current ability. During this time period, with the high volume of cases, the longer turnaround time, and challenges with the data reporting system, our assessment of contact tracing capability is leading us to represent this benchmark as red. We want to remind everyone, again, we talked about this on Tuesday, to please take personal responsibility and quarantine themselves at the first sign of exposure. You should not wait to receive a call from public health to start taking action. Isolate yourself away from everyone if you have symptoms or have been exposed, and start calling your close contacts to make them aware so they can start quarantining. Additionally, if you've been tested, regardless of whether or not you have symptoms, please quarantine until you get your results. We encourage any of our media providers who are listening to reiterate, or any of our medical providers, who are listening to reiterate this message to their patients as well. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, the East Region, or patients from other jurisdictions. During this time period, there were 11 red flags and 2 yellow flags detected for the number of inpatients with COVID-19, of which there were several 3-day trends. Additionally, there were 11 red flags and 2 red flags detected for COVID-19 patients in the ICU, some of which were occurring on consecutive days, and 6 red flags and 1 yellow flag were detected on consecutive days for the number of COVID-19 patients on ventilators. After speaking with our hospital partners, they have recommended that this benchmark be represented as red. As always, the hospital systems continue to meet routinely, work together, ensure that no system is impacted disproportionately, and plan their response together to best serve the community. The decisions on how to classify this benchmark are made in concert with our hospital partners, as well as taking all of the data into consideration. Before we move on, we want to briefly point your attention to new addition to this benchmark. We've added a section titled Adult Non-ICU Beds. The hospitals felt like this was an important distinction to make, as all hospital beds, the area above that, beds such as pediatric, and behavioral health beds, where COVID-19 patients would not be placed due to safety reasons. The adult non-ICU beds give us a better look into the available beds that could be used for COVID patients outside of the ICU in our hospitals. Moving on to the fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. For this benchmark, we use a graph that shows the reported deaths of Knox County residents by date of death. We have seen 26 deaths related to COVID-19 over the past 7 days and 36 deaths in the last 14 days. This information leads us to represent this benchmark as red. And finally, under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of Tuesday, our 14-day trend line shows 47 new cases per 100,000, and our 7-day trend line shows 60 new cases per 100,000. Again, similar to the first benchmark, it shows the amount of growth that we are seeing at this time. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is 20.17%. Again, just really demonstrates the amount of disease burden that's in the community. And with that, we'll open it up for questions.
All right, please go ahead and submit your questions into the chat feature. From Jeff with WATE, do we know when the quarantine change will apply to the Knox County school system?
We're working through that diligently, and we're trying to get it implemented, and as quick as we can, we will, and we'll let you all know, and the Knox County schools will let their folks know as well. I don't have a firm date. It's there, like I said, there's a lot of things that have to come into play, and we still need to get more guidance from TDH.
From Cole with WBIR, says you have a question about the benchmarks. The KCHD site says there are only 8 ICU beds available in the East Tennessee region. However, last night, Blunt Memorial Hospital told us it had 9 ICU beds available. Is there a simple possible explanation for this discrepancy?
Yeah, it's probably timing and when they updated their beds in the system and when we pulled the data. So the data that is on the benchmark data would have been pulled Wednesday morning, I believe. And that was what was, or Tuesday. It's Tuesday night, sorry, Tuesday night. And so that would have been for Wednesday's publishing, sorry. So that was the data that was in the system at that time. And that's likely the difference in the numbers.
From Megan with WBLT, there is a large gun show scheduled to occur at the Expo Center. Does this event or other similar events violate the new gathering limit? And will organizers of similar events face consequences for violating the order?
So the Expo Center is a private business, so I don't believe that would fall into what the new regulation covers. But really, let's get to the brass tacks there. Of what we're wanting to talk about is recommending people about being separate from each other and keeping that 6 foot of distance. And so the regulation that's there now in general is trying to keep people where they are able to keep that 6 feet of space around them for safety concerns. And so, you know, whether or not it applies, I think people should take caution when they're going to any area that they might be potentially exposed at this time with the amount of burden that we have of disease in the area right now. The second part of the question was about enforcement.
Yes, it was, let's see, will organizers of similar events face consequences for violating the order?
Again, the order's new and still absorbing all the details, but I don't believe that private locations are in there, and it's up to law enforcement and all of the other regulatory folks to decide how enforcement plays out.
From Cole with WBIR, what did you think of the language in the latest White House Coronavirus Task Force report? Is our local situation as dire as they make it out to be?
Yeah, it's very profound. It was very direct in the report this time, and I think it should have been. We are at a crossing point here, and we need to make sure that people really know the risk that's in the community, and ask people to heed all of the caution that we've been putting out there for months. And it's so important right now, and so it's really 100% in the community's hands to make decisions about how they're going to move forward over the next few weeks and months.
From Vincent with the Sentinel, on November 24th, there was a spike in test positivity rate of 47%. How many tests were conducted that day? People reached by contact tracers, and did those people?
You're asking me how many were reached that day on that day a week ago. So sorry, Vincent, I'm just laughing. I can't answer that, but what I can tell you is that we've looked at that data, and we pull that data directly from Tennessee Department of Health, and that was a very low test reporting day. I can't explain why that happened, and I'm not going to speculate, but I can say that I think there was only like 160 something tests that reported for Knox County that day in the system. And almost half of them were positive. And so, you know, that doesn't mean that what's reported in that system is what's in our line list that next day, by the way. So and so there's other ways that the information comes to us from faxes and other areas. So I can say that we were making an attempt to get to everybody within the 24 hours, but I can't give you the exact percentage today of what that day looked like.
From Megan with WBLT, is there a contingency plan in place in the event that all ICU beds in the region are filled?
That's a great question for the hospitals, but I will say that there's lots of plans in place. There's lots of things they can still do. It is sobering to see such low numbers of beds available and ICU beds available, but they still have a lot of things that they can implement and things and plans that are in place to be able to accommodate the need as it comes in. And so for more details, you can talk to them. But I think that, again, another reason that people should be taking this very seriously, though, and trying to limit the risk to themselves and to their friends and family so we don't continue to burden the system the way we have.
Jeff with WATE, will the Knox County Health Department investigate reports of social gathering limits? Will you refer calls you get to law enforcement? Is there a punishment mechanism?
Yeah, we're still working through the process, and probably will look similar to how we've done all of the other complaints that have been coming in, but we'll have to get more details on that. Again, since this was just passed last night, still working on the details. It's actually not officially out there just yet, so we're working on it.
Cole with WBIR, following up on his question about ICU hospital benchmark. He says, thank you for the explanation. At the point to pull the hospital bed capacity data from the HERT system, can you tell if all the hospitals in our region have reported? For example, could Blunt Memorial just have not updated their numbers and thus the system assumed no beds available?
Yes, I can see that they had all updated, but there also are human beings that are doing all this. So there could have been a discrepancy in the numbers as well and what was put in the system. But yes, when we pull the data, we can see that everybody's updated. And I don't believe I heard that they had not on that day.
Also from Cole with WBIR, the White House Coronavirus Task Force says people 65 and up should not go inside public places and get groceries or medicines delivered. Do you agree with that recommendation?
At this point, I do when it's possible. I think that everybody that is at high risk for serious complications from this need to be very, very cautious right now because there is a lot of disease in this community. I know that's not 100% something that everybody can do that are in that age group or in those high risk categories. But we really want people to think about what kind of exposures they need to put themselves into, what kind of situations they need to put themselves into for exposures, and just make the best decisions they can for themselves. And I also encourage people, if you know that you have a neighbor that falls into that category that needs help, ask them if you can help out and get their medicines or help pick up groceries if they don't have ability to do it themselves so they don't have to put themselves at risk. I think it's really time for us to help out. We've been doing it a lot, but really step up our efforts to help out our community and our neighbors so we don't have to put them in those situations.
Also from Cole with WBIR, he says to clarify, will the new CDC guidelines apply to Knox County schools eventually, even if there's not a specific date for it?
Yes, yeah. So all of Knox County will be moving to implement those guidelines, and isolation and quarantine guidelines, even for Knox County schools, come from us. And so we will be working towards that, just working out the details as we speak.
Also from Cole with WBIR, if someone recovers from COVID-19, are they at risk of getting it again? Do they need to take precautions like everyone else?
Yeah, we still recommend folks, continue to wear masks and follow up because there's still a lot of unknowns. How long that your immunity lasts, your natural immunity lasts is still, there's questions there. And so please still follow the 5 core actions all the time, even if you have had it and recovered.
The next question we have is from Vincent with the Sentinel. He says, I was told to ask the question about test positivity by your JIC in this press conference.
Yeah.
I don't expect you to know these things. Can you please look into that and follow up?
Yeah, I don't know that I'm going to be able to get you the exact percentage, which is why for that day we're working on being able to do that. And Vincent, I wasn't trying to be ugly with your question. It made me laugh because that would be a hard thing to keep in mind. But we're working on how we're going to be able to provide our percentage of cases with the state doing a piece and us doing a piece. And so we're working on being able to do that moving forward, but I don't know that I'm going to be able to do it going back. And that's part of the updates in that benchmark we've been talking about. So I'm sorry, but we'll provide you the information that we can provide as soon as we get to that point.
Also from Vincent with the Sentinel, a question about the Expo Center. How does the social gathering restriction not apply? From the resolution, a person who owns, manages, operates, or otherwise controls any indoor or outdoor public or private space in Knox County and who knowingly fails to comply with any provision of this regulation may be subject to such orders and or penalties as are provided by law.
You are right. I didn't think about that part, but the piece of that I don't think I explained well is there still is the square foot detail, the square foot piece. So it's 10, I don't I'm going to say this wrong. Help me, Kelsey.
10 people for
10
360 square feet.
people for 360 square feet. And so, thank you. And so very large facilities that can accommodate more people because of their square footage can still operate in this situation. We just really strongly encourage the facilities and everybody that's there and the people that are going to ensure that they're following the 5 core actions. That's what the design of the policy is. And I'm sorry I misspoke earlier about the private facility piece.
From Cole with WBIR, if someone recovers from COVID-19 and has antibodies, could they still spread the virus without getting it again? For example, could they be a carrier without getting sick?
That's a really complicated one, Cole. So while there may be antibodies, the protective factor of those antibodies is the question at this point in time. And so the data that's out there right now says that it looks like about 90 days, but we still don't know 100%. And so the recommendations are still to follow the 5 core actions, even after you've recovered. We've had people in this building who've tested positive previously, and they're in mask and still staying 6 feet apart because we just feel like that's the safest option, and we encourage everybody to do that. But we really don't have a good handle, again, with this being a new virus, on exactly how long those natural immunities and those antibodies, how long that protective factor is there to keep you from getting sick and becoming infectious again.
From Jeff with WATE, you mentioned in the benchmark presentation about noting the number of non-ICU beds versus ICU beds. Can you explain that again?
Yeah, so the decision was made there. We had a lot of discussions with the hospitals about this and really appreciate their input. It's actually more related to the all hospital beds piece. And so the big number that's there, I think it's 3,000 beds or something like that, that we have on our website, encompasses all of the beds that are out there in the region. It's the 16 county region, I think 19 hospitals. But that includes beds like labor and delivery beds or behavioral health beds. It's not a safe option. It's not a good idea to cohort or put COVID positive patients in labor and delivery, for example. So there's some areas that it's just not feasible to put these patients in. And so it kind of inflates what it looks like the hospital's capacity is when you have all of those in the calculation that the folks were looking at, the public's looking at. And so the adult floor beds is a better reflection that aren't ICU beds because they are counted separately down below. It's just truly a better reflection of beds. Generally, those beds can be used for COVID positive patients. And so that data is just a better reflection of what the hospital's true capacity is. And they felt that it was important to share that with the public, especially as they were changing their benchmark and getting more concerned about the capacity that they're seeing. I hope that helped answer the question.
From Cole with WBIR, Tuesday you said contact tracing would soon be nearly impossible. Are we there yet?
We're not there quite yet, but like we talked about on Tuesday, we are reviewing with our team on ways that we can be more strategic in our contact tracing and prioritize a little bit more given the volume of cases that are coming in and the rapid growth of cases that are coming in. You guys can look at the charts. I mean, it's shooting pretty straight up right now, and so on average, and so we're working on that. We haven't settled on a final decision on how we're going to do that yet. We really wanted to get the input from the team themselves. They're the ones that are in it day in and day out and have really good ideas. But we're still in the game, and we're going to continue to be in the game for a while. It just might look a little bit different coming up soon.
From Jeff with WATE, the traffic light system was originally set up as benchmarks for continued reopening shutdown earlier in the year. Now it seems like we're in a very different phase, living with the virus while awaiting the arrival of a vaccine or large-scale immunity. Is the traffic light system still an effective model for assessing the virus situation? And could a different metaphor be more effective?
It's possible. It's meant to be a communication tool to the public, and so and for us to try to be as transparent as possible with you all and with our community. I hope that it still does that, and we'll continue to put the information out there that we have. But we really wanted to share. There's some people who like the nitty-gritty details that are also out there, but there's other folks that really just wanted a how are we doing in the most simple terms, and that's what I think the benchmarks convey, and hopefully they'll continue to do that.
From Alan with Inside of Knoxville, the state website reports Knox County's 7-day average for positive test results at 15.9%, while the Knox County Health Department, supposedly based on state data, reports a 7-day average of 20.17%. Why such a big difference?
I think those days, again, I think the state benchmark or the state report is pulled on either Saturday or Sunday, and then ours is pulled later in the week. So there's always going to be some discrepancy there. And so that's really the simple, it's a dynamic situation. And just look at, again, we tend to look at trends instead of one data point. And so it's really probably a timing thing more than anything, because we are pulling it. It's just when we're calculating the percentage, it's a little different.
Nicole with WBIR, we've reported a lot of deaths recently. Do you know if the mobile morgue unit TEMA sent to our area has been utilized?
I do not know the answer to that question. I would speak with the forensic center.
Any further questions, please go ahead and submit them. From Jeff with WATE, following up on the benchmark question, now that we're all red, is there anything else the county can do to stop the virus?
I think we've been very clear and very direct on that this week, is that it's really in the community's hands at this point. It's in every one of our hands to be able to start to try to turn the tide as best we can, and it's going to take some time to do that. We need everybody to still follow those 5 core actions. We haven't changed from that message. And really start taking that personal responsibility on where, again, if you're feeling ill and you've gotten tested, go ahead and isolate or quarantine yourself. And then if you're a contact, go ahead. If you've been told you're a close contact to a case from your buddy that you spent an hour with earlier this week, go ahead and quarantine yourself. We need everybody's input. We need everybody's buy-in to really start to make some inways into what we're doing. We haven't seen Thanksgiving completely yet, and so again, can't stress enough. It's in the community's hands. We've got all the messaging out that we can, and we will continue to push that out. But we really need everybody to follow the guidance and the recommendations to help protect each other.
From Brian Hornback, shouldn't Knox County schools close since we are all red?
Their metrics are also, while they look at our benchmarks, they also look at their internal metrics on their ability to continue to provide instruction. And it's ultimately the school's decision. And we talk to them frequently, and they are making those decisions on a case-by-case basis, and we'll make a larger decision on their end as well from their leadership with our input. But there's a lot of different factors. They have their own set of internal metrics they look at as well that weighs in on that.
From Megan with WBLT, have any hospitals said they will begin to divert patients due to capacity issues?
That's a great question for the hospitals. That happens occasionally, off and on. Dr. Shamia spoke about that last night, I believe, a little bit. And it does happen, and it weighs in on their decisions. And I think for the specifics, I would refer you to them to get the details on that.
All right, I'm not seeing any other questions in the chat feature, and since we're creeping up right at 1 o'clock, I will assume that's it from everybody. So thank you all for your time today, and we will see you again on Tuesday at 12:30. We hope you have a great and safe weekend.